Good morning, everyone. My name is Sam. I'm a GP. Welcome to my medical presentation. Today's topic is on sexual health, specifically sexually transmitted infection. Before I begin, I just want to show my disclaimer. As usual, I like to begin my presentation with a case study. I've got Mr. W, a 31-year-old male. Several weeks ago, he visited a red light district and had an unprotected intercourse with a sex worker. Subsequently, he went on to develop a penis sore, which was very painful. He then presented to his GP, and his GP went on to examine his genital. And this is what his GP found on examination: a blister on the tip of his foreskin. Subsequently, a full STI check was conducted. So, here is the blood test results of one of his STI check. It's called herpes simplex serology. In this test, the patient was found to be positive for herpes simplex 2 IgG, which confirms infection with herpes simplex type 2. A swab test was also done on his penis. In this virus swab, a swab was used to pick up the DNA of a herpes simplex virus 2, and in this case, it was detected. So what is the difference between herpes simplex serology and virus swab? Serology test is a blood test. It shows an antibody response to herpes simplex type 2 infection. Antibody is components of the white blood cell, which is used to fight an invading virus. The development of this IgG response may take up to 6 weeks to show up positive following exposure and infection with herpes simplex type 2 infection. A positive test result means that the patient is infected with HSV2 at some point in time, usually sexually acquired and from a skin-to-skin contact with an infected person. However, a positive test does not mean that the person does not imply that the person is having an outbreak of a sore or is highly infectious. Nonetheless, the patient can still shed virus even without symptoms, or he or she can still shed viruses from sores that may not be visible from naked eyes. Next, we talk about the virus swab. A virus swab, as the name implies, is a swab, as shown in this picture here. It is a diagnostic method of choice or a testing method of choice when the patient is having symptoms, such as a sore on a blister on his or her genital. This means using a virus swab to strongly swab a visible blister or an ulcer to test the content of the fluid. Because the patient is having a sore or an outbreak, the patient is more infectious at this stage too. So what is genital herpes? Genital herpes is commonly a sexually transmitted infection. It is caused by herpes simplex virus type 2 virus. It is usually spread from skin-to-skin contact, either through genital sex, anal sex, or oral sex. And because of the different type of sexual activity, the sore can appear on different locations depending on where the infection takes place, such as on the penis, vagina, or on the anal region. So symptoms can be classified as general symptoms, where the patient can experience initial flu-like symptoms. This is then followed by local symptoms such as tingling, itching, burning pain, subsequently development of painful blisters or ulcer, as shown in this picture again. And because these ulcers and blisters are painful, it also leads to painful intercourse as well. So next, what is the treatment for genital herpes? The treatment of genital herpes depends on whether it is a first episode, it is a recurrent episode, or it is a frequent recurrent episode. For the first episode, the treatment is an antiviral medication called Valtrex, 500 milligram twice a day for 5 to 10 days. If a recurrent episode of outbreak happens again, the treatment can be repeated. Again, Valtrex 500 milligram twice a day for 5 days. It is recommended that treatment commence as soon as the patient is aware of the development of symptoms such as tingling, itching, or burning pain. For patients who experience more frequent outbreak of genital sores, if it is less than 10 times per year, a suppressive therapy is recommended with the use of Valtrex containing well-acyclovir 500 milligram daily. However, if recurrence is very frequent, occurring more than 10 times per year, then a suppressive therapy of 1000 milligram once a day is recommended, as long as outbreak keeps recurring. Next, we talk about prevention. Because genital herpes is a sexually transmitted infection, the only way to prevent genital herpes is to practice safe sex and to make sure that potential partners are tested before initiating an intimate relationship. It is also the responsibility of any individual infected with HSV infection that they inform their ex-partner to be tested and treated, and to responsibly inform potential new partners in the future so that they can take appropriate precaution. Finally, I want to quickly discuss about cold sore, which is HSV type 1 infection. Cold sore, as the name implies, is a sore that happens during winter, and it is during winter that the outbreak of cold sore is more common. And this outbreak of cold sore, as demonstrated on this picture, shows that it usually happens around the lips area. While it is not commonly a sexually transmitted infection, cold sore can also spread from the mouth to the genital or to the anus area, and can result in genital sores too. However, after treatment, HSV1 or cold sore recurrence on the genital area is less frequent than HSV2 infection. Thank you for watching my presentation. If you like my presentation, please kindly subscribe and share. Again, thank you. Stay alive, stay safe, and stay healthy. Many thanks. Have a nice day.